Alrighty. While the remaining attendees join, I'll get things started. So, hello everyone. Thanks for joining. We're very excited to host our fifth annual virtual pathology student interest group program director panel this evening. Glad that everyone can make it as this is our most attended event. So hopefully we get some great information shared with you today. Just as a reminder, the session is being recorded and will be posted online in a few days that can be accessed via our YouTube channel or our website where all of our event recordings are posted. To introduce myself, my name is Ryan Mack. I'm a current MD PhD student, a MS3 at Loyola University Chicago Stritz School of Medicine, and I'll be moderating the Q&A today. I also want to recognize my fellow event coordinators who helped put this event together. Thank you for your time, your dedication to this. They'll be active in the chat today, monitoring for your questions. So as those questions come up, feel free to just type them and they'll shuttle those to me to read. So I'd like to introduce Seth Adler from Rush Medical College here in Chicago with me, Ashley Padilla from Ross University School of Medicine, and Matthew Leong from Michigan State University College of Osteopathic Medicine. Normally, we would have the founder of this group, Dr. Kamran Mirza, kick things off for us today. Unfortunately, he had a last-minute family emergency and won't be able to make it to join, but I have the great honor of overlapping him while this group was founded during his time at Loyola. I know now he got pulled over to University of Michigan, but I know he's incredibly proud of the turnout today and the community that we've built here with aspiring pathologists. So on his behalf and the entire Virtual Path SIG team, thank you all so much for being here. Before I introduce our panelists, just a quick note on housekeeping. We'll place a link to our Pathology Residency Program open house calendar in the chat. So while we have wonderful PDs here tonight, I know that other open houses are in full swing, so please feel free to bookmark this to keep track of upcoming events in this match cycle and hear from other program directors about their programs. To keep things moving smoothly today, all attendees should remain muted. We'll be starting off this meeting with pre-submitted questions, so thank you to everyone who submitted those during the registration process. If you have additional questions, as I mentioned, please go and submit them in the chat. Seth, Ashley, and Matthew, as well as Tracy, will be keeping an eye on it, so we'll try to get to as many live questions as time permits. So today we're thrilled to introduce our incredible lineup of panelists who are taking time out of their busy schedules during the season to be here with us today. So please welcome Dr. Ann Mills from the University of Virginia, Dr. Ron Balassanian from the University of California, San Francisco, Dr. Lindsey Westbrook from the University of Colorado, Dr. Sean Lee from the University of Michigan, and last but not least, Dr. Marie DeFrances from the University of Pittsburgh Medical Center. So we're all very grateful to have you here tonight. And with that, let's get our panel started. We organized our pre-submitted questions into a few of the main themes that we saw from those pre-submitted ones. So while we may not read your exact question, just know that they were likely kind of bundled and covered into one of these topics. So first, we'll touch on the initial application filter process, focusing on logistics, signaling, and academic merits. So I'll direct the first question to Dr. Westbrook. How do you use ERAS signals and geographic preferences when selecting applicants for interviews? And others, please chime in after she's done.
Yeah, so we actually, since they have become a thing in pathology, we rely heavily on program signals and geographic preferences. So we have, we're kind of a medium to larger size program. We take 6 to 7 residents a year. And so we interview still about 10 per spot. So 70 to 80, somewhere in there, depending on how many we're taking that year. And I will say that we get almost that many program signals, and some of the well-represented, very prestigious pathology programs are represented here tonight by the PDs. And so I'm sure they probably get more than we do, but we actually get quite a few program signals. So it's fairly easy for us to select largely from the pool of applicants that are giving us program signals and geographic preferences. So yeah, I would say we rely heavily on them. I don't know how other people are using them, but we have been using them a lot the last few years, and they've been really helpful in identifying those people that are interested in our program before the interview. So yeah, we use them a lot.
I'm happy to chime in that I would absolutely echo that, Lindsey. At the University of Virginia, where it's in sort of a similar boat, where because there are so many well-qualified folks in the signaling pool, the majority of our interview slots will go to that pool. And I will say that it's really helped solve a problem that we all dealt with when these went virtual, which is that previously someone's dedication to a program was demonstrated by them making the journey. And so while you may offer lots of invitations and maybe even get, the majority accepted by candidates, there would be an attrition in interview slots. Typically, a program would see 25-30% turnover in people who might have initially said they'd interview and then they ended up opening up the spot. And from our perspective, that was great because you would just enrich for people who wanted to be there. With virtual interviewing, there's the only penalty to doing an interview is you lose, 8 hours of your day. And so I think, all saw that people were taking far more interviews than they were really serious about. And I understand the impetus. It's really stressful to be an applicant. But I actually think signaling is really good for all of you guys because it means that you can put your application at the top of the heap for the programs you really care about. And it won't be the same pool of folks who are taking really a disproportionate number of interview slots. So it's possible to get an interview at UVA without signaling us, but it is significantly harder if you do not signal our program. At least two-thirds, not everyone who signals our program will get an interview, full disclosure, like plenty do not, but at least two-thirds of our interview slots will go to signaling applicants.
And would any other PD want to talk about like how geographic preferences are kind of distinguished from signals? Is it that signal that becomes the top priority, or how does geographic preference play a role? Because it's kind of two things happening at once.
I would just add with the signals that for our program, we only use the signals for selecting candidates for interview. Once you interview, it's no longer a factor. We determine where you're going to be on the rank list based on the interview and your application, but we don't look at the signaling anymore. And sometimes people go back to it and we're like, no, 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 that's history. So we take that out of the equation. The geographic preferences don't really help us that much because it's California to Washington State and Hawaii. It's like, so sure. I think Nevada's in there too. But we look at it, but it's not that important to us.
Yeah, and I'll just jump in at UPMC that we do look at signals as well, and we'll use them. For example, if there are two applicants that are equivalent to one another, we'll use the signal potentially to give somebody an interview invitation. The other thing is that of our applicants, we interview about 80 individuals per year. In our last cycle, I think we had about 27 or 30 that signaled. So, but we had, of course, more people that actually did signal us but didn't get interviews. So we're at about 1/3 that interview with us. Have have signaled us and then gotten an interview with us, or a little bit different. On the other hand, I think about 80% did geographic preference our region, so we did have a lot of geographic preference in our pool.
Great. Okay. Oh, please.
I was just going to say that we definitely use geographic preference also because unlike California, there's only 5 pathology residencies in the mountain region. So we assume if people give us mountain and didn't signal us, we joke that they're trying to go to Utah, but we interview a large pool of people that just give us a geographic preference too. So yeah, we also rely heavily on geographic preference.
Wonderful. I'll direct this next question to Dr. Balassanian. We know that programs do look at the whole applicant as well as the signals, but we had a number of questions come in, of course, about step scores, and not just kind of like the general question around how much are you paying attention to step scores, but also step attempts, so the number of times that people are taking step, or any other sort of like academic or kind of personal setback that might kind of be following someone for whatever reason. So how do those kind of carry in your holistic review and final ranking of applicants?
Well, we we divide up the applications. We receive about 600 each year, and we divide them by our reviewers. Last year, we started including residents on our review panel, which has been very powerful, and also on our interview committee. Two reviewers need to review the application. If the applicant gets two yes votes, they get invited for an interview. If they get a yes maybe or a yes no, the two program directors, myself and my associate program director, will review the application again, and then we decide if they come for an interview. We don't fill all our interview spots with yes, yes. We don't weight any part of the application more than the other. So I would say if your board scores, I mean, if you pass step one and you don't have a very high score on step two, but you have stellar letters of recommendation, or you've gotten honors in a pathology elective, we're going to notice that as well and not really put that much weight on the board scores. But if it's a consistent theme through your application, that might make it harder for you to get a yes vote from one of the reviewers. So there's no one part of the application that we factor more than the other. And then what was the other question for the holistic review?
I think that kind of
Okay,
covered
that covers
that.
it.
Yes, it was just kind of how these are being incorporated into the kind of review process. And so that clear
Oh,
kind of yes, 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 maybe. But
the other thing I wanted to say is if you do have an academic setback, if there you failed a board's exam at some point, or there was some problem with a rotation, we, I would rather see someone confront failure and overcome it than to see someone who's never had a problem in their life, because I don't think those people are real. But just saying, that's my own opinion. But if you've had a problem, address it. Address it in your personal statement. Be upfront about it. Put in meaningful experiences at the top of your application. Let us know what happened and give us a reason to vote yes for you, despite the event.
sure thing. Does anyone else want to chime in on this? Either on the setback kind of interpretation or just step scores generally?
I can chime in and similar to Ron, like everybody who's honest is failing at some point. That said, like not all failures are created equal. And so I think contextualizing failure is really important in helping us understand. Similarly, I think most programs have some sort of rules, hard or soft, about who they're looking for. And so you'll see on most of our websites there, sorry, I have a dog who's very loud, shaking around in the background. For instance, at UVA, we have preferences for the length of time since completing medical school. At the same time, if you've been out of medical school for some years and you've been engaged in pathology, that may actually be an attribute to your application, right? If you've been doing cardiovascular research that really has no overlap with histopathology or any of the work that you would be doing in residency, that's not necessarily going to help you. But if you've sought out opportunities to work as a pathology assistant and actively been doing pathology observerships, that kind of distance from graduation will be weighed differently. So I think the same is true for being unsuccessful. So there's a lot of animals in this room. You can probably hear the cats now too. The kids haven't come through yet. They might. But help us understand if something happened in your career path that could be seen as a negative, make us see it as a positive. If you have spent some time away from a conventional training track, help us see how that can be an attribute, because certainly we love having varied expertise. The cat is on the desk and I'm going to unmute.
Yeah, I'd agree with that. Can you guys hear me okay? Okay, great. Thanks. This boom sometimes glitches. Yeah, I'd agree with everything that was said so far. Um, uh, I definitely like to see um, someone explain what they've learned, how they've changed their approach, if they've had a setback, if they've had to remediate a clerkship or something, or was unsuccessful with a board exam. Um, I, I'm always very pleased and astounded to see those who just really come roaring back, and those are the kind of people that I want to really try to recruit to our program too, because they've learned something. Um, and it shows a lot of like character too. But I think also overall, there's a probably the question is rooted in, or maybe adjacent to some of the stigma people might feel from their particular pathways, or having to change what they were doing, or um, maybe running out of options. We've had our program has initially got some flack for bumping up our um, recruitment of DOs, but we have an amazing program just up in Lansing. They have a dual, like an MD school and a DO school, osteopathic and allopathic school, and yeah, they're just a great feeder for us. We've had great residents from some of the Caribbean schools as well, which have a bad reputation, I suppose, by name, but they're really hard and really expensive. And people who go there, they're determined. Um, so I think overall, uh, I there seems to be a good story to tell, and that those people can tell us, and I really enjoy reading those applications. Um, I think they bring something to our program in terms of that experience. I think Dr. Mills touched on too.
Right. I think that provides a way that I'll direct this question to Dr. Mills and pivot. So when talking about like your personal story, talking in your personal statement, we received questions because there's a lot of conflicting answers about how to frame that when you have a specific program in mind, a specific location in mind. So when you're reviewing personal statements, would you recommend people are writing kind of program specific personalized statements to express interest? Or is having that kind of signal and geographic preference sufficient?
Yeah, I'm happy to answer that. So I think that you certainly just want to express genuine and authentic interest in any avenue, right? So if you genuinely want to go to the University of Michigan because you have read all of the hematopathology papers that that group has published and they have inspired your career path, write that. But don't make it up, right? Like just be genuine and honest. And that means like it, and you know, I think that it is quite possible to have genuine and honest, strong interest in lots of programs, but I wouldn't say you should feel that you have to go to every program that you signal and say, I really want to be at this program because it's probably not true. Certainly I would say that it's always nice to see something specific to UVA in a personal statement, and it kind of feels good for us, right? But by no means are we looking at, certainly among our signaling applicants, and saying, well, they didn't call out UVA in their personal statement, they must not like us in the discard pile, right? Um, so I think be genuine. I could see a scenario in which a program that you haven't signaled, who is going to the trouble to carefully review your personal statement, might find that sort of tantamount to a signal. That said, it's not like a get an interview free card, because many of those programs will have already given most of their spots to signaling folks. So I would say like I really feel for you guys. Residency applications feel so stressful, and there's this impetus or like instinct to kind of try to gamify it. And I would say that the career you want is the one that is authentic to you. And if you just really decide who you want to be on your career path and be as honest and coherent in your story about that, and put it out there, you will land on the path that is right for you. Don't try to gamify it, just be authentic. And if that manifests in a institution specific personal statement, great, but don't write 10 institution specific statements just because you're nervous. Like the signaling will do that for you.
Yeah.
Right, Dr. Lee. Oh, sorry, I
Oh,
saw Dr. Lee's hand was up, but
oh,
Dr.
that's okay. Sorry,
DeFrancis, do you
Dr.
want
Lee,
to
you can
chime
go.
in?
Dr. Lee, do you want to go?
Yeah, thanks.
Yeah.
I'll be quick about this. I totally agree with Dr. Mill says. Um, we can tell when someone is cookie cuttering a lot of the time. Years ago, I had somebody who was putting the institution specific part in a different font and size. And, you know, if you're going to do that, be very careful and double check where you're sending things too, because you don't want to get your signals crossed. Be genuine. It's okay. You can genuinely like multiple programs for multiple different reasons, and you could definitely see yourself in training in different places, just like you could see yourself in different subspecialties. Express that, right? But be very, very diligent in what you're doing with your application, because it really throws us off when you're expecting something and then things go sideways. And I feel terrible uh for those people who um just I think get their signals crossed and might have shot one sincere letter to the wrong place or something like that. And with those letters of recommendation too, making sure everything's cohesive. Uh, it, it's always helpful to have those um, writers understand your story too and the story you're trying to tell us in your personal statement and tie those things together. Contradictions are a head scratcher too for us. Um, so yeah, I mean, just be very careful in what you're doing, and I agree. It's be very genuine, be authentic.
Yeah, and I guess I'll just jump in with that. But yeah, I agree with this sense of authenticity in the letter. And I personally like to see a letter that tells us, how did you get interested in pathology, to begin with? How did you sort of manifest that interest? What did you do? Research or electives, what did you do to solidify that interest? And then I like to see a part about the future. Like, I know you might not know, you might just think that, hey, I'm going to be a PCP. I really don't know what I'm going to do as a fellowship or for a career or whatever, but putting like your sort of last paragraph, just giving a little bit of thought of what you think, might be some options for you for your future. I really like to see that because that means that the individual has taken the time to understand that, the vast majority of residents are going to go on and do a fellowship, that there's a couple of different, types of career paths after finishing up residency and fellowship, and expounding a little bit on those if you have any inkling about that. So I really like to see an sort of a nice half circle arc, if you will, in storytelling in the personal statement. And I would encourage you all to limit it to one page. I know that I have heard, I'm not sure if anybody on this call in terms of program directors, but I've heard program directors say that I will not read it if it's beyond one page. They will stop reading it. I'm not like that, but just be mindful that there might be some program directors that might do that.
Right. Before we move into some of the various other components of that application, if anybody had any last comments about personal statements, things that stand out to you, if anybody has anything else to add before we move on.
I'll add something. Um, we're pathologists, know your audience. This is not creative writing class. We don't need the dramatic opening. We don't need the first person narrative. It's not a novel. Tell us what you did in long form and what you want to do in the future and how pathology fits into that vision. You can bring in some creative elements to it, but we don't. I'm going to be cautious about what I say, but a lot of essays are written about I like puzzles or I did a frozen section, and that's perfectly legitimate. I get that. You want to connect to pathology that way, but so many of them are written that way that now they don't stand out. So try to talk to a pathologist at your medical school or a pathologist that get some exposure to it, write about something different. And remember, we're scientists and pathologists, so we're used to scientific writing. So parallel sentence structure works for us. I did this, I did this, I did this, I did this. Fine, that's okay. It does not need to be all flowery and beautiful and so forth. It could just be very straightforward, and it's like, I get it. This person's going to be great.
Ron, can I just echo that? We have a joke among my applicant reviewers that the first rule of a personal statement is the same as the first rule of doctoring, which is first do no harm. So we have metrics for which we weight every aspect of an application. Your board scores, your academic record, your experience in pathology, the quality of your letters, and your personal statement. The personal statement is the value for which they are usually going to be, our scores are basically -1 to 2, and then we add them up. They will usually just be ones. Like, it is uncommon that a personal statement will be a 2. It is more likely that in shooting for a 2, you will bring yourself down by being weird. And the second thing I will say is AI is not your friend. We are looking for authenticity. We have read enough of these. If you spit in, write me a personal statement into your whatever AI generator of choice, you are going to give us a personal statement that echoes a bunch we've read before, and we're going to roll our eyes. So be authentic, use a good command of the English language, and don't be weird for the sake of being recognized. Is that, program directors, is that fair? First, do no harm.
First, a good personal statement is not going to get you into the program, but a bad personal statement will keep you out of it.
Yeah,
It's how you want to present yourself to the world in one page as a pathologist.
I would agree with that last part wholeheartedly. I I don't know. Um, I don't know how much somebody who comes from a lower resource medical school or smaller medical school can stand out so much with um, maybe when I did my pathology elective, it was a 100-bed small private community hospital with 2 pathologists, and I had a good, really routine experience as you would find with a sort of a Jack or Jill of all trades kind of operation there. And uh, I think you definitely don't want to overreach. You don't want to make
Yeah.
stuff up. Be sincere to what fascinates you and what drives you about pathology for sure. Um, I totally get that. It is such a fine balance. I mean, we're
Yeah.
pathologists. We're all kind of, you know, but it is a fine balance. And one of the best residents I have right now in terms of um, just crazy shoot from the hip skill. He wrote about trial and error in baking, um, and tied that into his philosophy of learning. That was out there. That was really out there. Fortunately, he also holistically had a really strong research background and other things too. But um, it's tough. It is the personal statement is nerve-wracking. And I think y'all deserve a lot of credit for putting yourself out there in those. Um, I'm sorry. I guess I just don't have. Um, I worry about uh, being formulaic about them too. Um, so it's risky.
Well, when considering the other components of the application, we can now kind of touch on moving kind of beyond that personal statement, moving beyond those step scores and basic numbers. So just like generally, how do you kind of conduct your holistic review? What makes an applicant truly stand out? And I'll direct this question to Dr. Westbrook. So beyond those scores in those metrics, what qualities or experiences are distinguishing applicants who receive interviews from those who kind of just meet the basic requirements but don't actually get selected? A big question.
It is a big question. I think one big one we already talked about was program signals and geographic preferences. I think you can't ignore those. Um, the other thing I will say at University of Colorado, we use a score sheet, and we do weigh things differently. We have our review committee, which is comprised of faculty, like vote how much they think each component of like each question should be worth. We average those, and there's a very complex scoring system. So we just essentially score every single part of your application. Some things that maybe you might not think of that we would look at are we love anyone who has obviously prior pathology experience in some way, whether you were a lab tech before you went to medical school, or you did pathology in another country, or you did a post-sophomore fellowship, those things that are very pathology specific, or even, I guess, work things that are not necessarily related to pathology, like you had your own startup or you worked in a different field before moving into medical school. We give those also consideration. Kind of speaking to some of the things that have already been discussed. We have like a green flags and a red flags comment box on our application scoring tool. So, if you do think someone's going to score lower, like maybe they had some sort of failure, course failure or step failure, those sorts of things. But there's something about their application you really liked, whether it be their personal statement or their story. You can comment in the green flags box. I think this person's probably going to score low on our scoring tool, but I really like them for this reason. So yeah, it's a large question, and everyone's coming from different. But honestly, I wish we could pick out the applicants that are look bit like very average on paper, because we've had some residents that look so average on paper and they are just outstanding. And we've also had some that look great on paper and they are, had struggled in residency for whatever reason. So I wish I could like pick out those ones that were very average on paper but are going to be amazing residents, but it's a really, really hard skill and I don't think I've mastered it. So maybe some of the more experienced program directors can have some advice on that.
I'll jump in from UPMC's perspective. We too have a big rubric for scoring, various components of an application. I will put in that an area that I really like to look for is a description of what electives an individual has done in pathology. My personal opinion is that I would recommend that, one of those boxes of your activity boxes, I think you guys get 10 of them, and I think one might be called like most meaningful. I think you have up to 3 of those. I personally feel that box, one of those boxes should be used to kind of list the different electives that you've done in pathology. I would encourage individuals, I like personally and our program prefer somebody to do at least 2 electives in pathology, one in anatomic pathology, one in CP pathology if they're going to be APCP residents in the program, and preferably having done those at residency programs, or at programs or institutions with residency programs so that they understand what it's like to be a resident in pathology. And then in that box, you can talk about, what did you gain from these electives? And so that is just another component that, that I would like to, bring to your attention that could be well presented in your application by using one of those activities boxes. I have heard applicants say that, oh, well, don't you just look at my my transcript and you see that I'm doing them, but I'm not sure what the other program directors say, but when you look at those transcripts, it's very hard to determine what electives are done, where they're done, are they actually done in pathology? So you as the applicant spelling it out for us, I think can have a lot of traction. Thanks.
I agree with that. It's so hard to find even how many electives on the transcript sometimes because of just the time of year the applications have to happen and um, some people are doing electives well into fall and winter even. So if you give us an idea of what you're planning to do and what you just laid out, what you've done, and make it easy for us, please. Um, and those transcripts, like no 2 medical schools have the same style of transcript either, and some are very specific in what the name of the course or the rotation is, and some just say like pathology. And it's so hard to tell.
You
Right.
can
Any
also
additional
discuss,
comments?
I was just going to say, you can also discuss the elective experience in pathology in your personal statement and baking.
So what I'm gathering is make sure your interest in pathology is clear,
That's it.
making the application easy to digest, easy to read as you're going through so many of them will help kind of elevate that. Great. So along the same lines, I'll direct this right back to Dr. DeFrances. And so besides those experiences, we got a lot of questions about research.
Yeah.
How is research kind of integrated? How do you view it? And so when you're evaluating applicants, especially those coming from sometimes major academic institutions, other times smaller programs, how are you evaluating research? Are some better than others? And then I will follow up just kind of on the changes coming to how research is reported in ERAS. But please go ahead.
Yeah. Yeah, great question. Clearly, and I think all of the programs that are represented here, we clearly get individuals who are like MD PhDs that have at least a couple of publications based on the fact that they've gotten a PhD. So, that's one type of applicant. But of course, there are many other applicants that may not have as many publications because they have not done a PhD and they have to work research in one way or another. Some individuals have taken some gap years and maybe worked as a research tech or some role and gotten publications that way. But others, again, go straight into medical school right after undergrad. And so, again, are kind of doing research while they're learning and having other responsibilities. So I think the way that our program looks at it is that research can come in many different forms and flavors. I've there have been applicants that have done like research in QA, and maybe you don't even think, well, the QA is not really research, but in a way, the thought processes that go into analyzing data. I think that again, I would imagine many of the program directors agree is that we're looking for individuals who can analyze data because that's what we all do on a daily basis. We have to analyze and synthesize data for every single patient that we are reviewing and writing reports for. So we like to see that they are capable of doing that. Now, maybe it hasn't turned into a full-fledged paper. Maybe it has turned into an abstract, maybe a meeting, going to a pathology meeting would be great, like CAP or USCAP or any ASCP, any of those meetings would be wonderful, where you're again having to synthesize your data, present it, and talk about it. So those are all good things. So we do, if somebody does have publications, we do like to see that, and that's going to get a little higher score on our rubric. But again, there are some other ways to fulfill that kind of domain, if you will, with some other activities that shows some, ability to synthesize data. I'll stop there.
I'll add, and I completely agree, like it's lovely to see a good amount of pathology research, but I would not worry if that has not been available to you. I consider particularly pathology specific research to be as much a reflection of opportunity as it is the individual trainee's passion. I do not see it as a deficit if you have not had that opportunity, particularly, I know we've referenced schools where there just aren't those resources. So don't worry if you're not doing pathology specific research. Personally, I would find it much more meaningful to see a trainee really spearhead a circumscribed quality project in pathology or, assist with an antibody validation, something just super practical that shows that you understand the nuts and bolts of what we do versus have some high profile fancy paper that has nothing to do with pathology. So don't worry if you're not doing research. Again, something targeted, and again, sorry about my loud dog, she's shaking a lot. Something targeted in pathology that is sort of low hanging fruit, just quality stuff would be far more meaningful to me if it showed that you really took the bull by the horns and pursued that opportunity.
And Dr. Lee, do you have your hand raised?
Yeah, thanks. Um, so I think uh, we take I guess, an approach where there are three or four. We want to see what you're doing outside of just your medical school education. Research is a big one. Um, but if it's not something that you've had mentorship in or opportunities in, but you've dedicated yourself to something else in a very meaningful way, like service or leadership or education, then that means a lot to us too. Uh, because not all of us, our graduates, are going to go into academic pathology and carry on a tremendous research career. I mean, slightly more than half of our graduates go into community and private practice. Uh, so so we just want to see what you've sort of applied yourself to and how you've succeeded and how you've grown in those areas as well. So I just wanted to point that out, or put that out there that you don't have to, there's only so many hours in a day. You can't do everything, or it's very, very, very hard to do everything.
I'll just jump in and add, first of all, I agree completely with Dr. Lee. We are a very research intensive institution, but even with that, and we have a very strong physician scientist track we recruit for very aggressively. But even with that, we want a mix of residents. We don't want to be pure research. So we want people who come in with real world experience, people who come in with maybe a post-sophomore fellowship or some deep pathology experience, or people who bring something unique to the program. We have had people come in approaching pathology from a social justice angle, which I never thought about. And another resident looking at health policy as a pathologist. So anything like that that you've done that's beyond just the requirements of medical school, emphasize that in your personal statement, have your letter writers talk about it. But um, we do value research. If you've written papers, that's very important, but there are many other ways to achieve that same level of us noticing your application and interviewing you and paying attention to it.
I can add to that. It's a line in our scoring rubric. I would say at our program, it's like it's there, but it's not an extremely high percentage. Like we like to see it, but it's definitely not going to make or break your ability to get an interview because again, yeah, we train 50-50 community versus academic. So yeah, it's nice, but it's not something that we require you to have for an interview.
Can I add one more
Great.
thing about research and the CVs? Um, be be very honest in what you're putting as papers and publications and so forth in your CV. Um, I mean, it's I don't feel really good when I see someone lumping in a bunch of abstracts, which is are their accomplishments in their own right, but they go in a separate section than peer-reviewed, um, publications. Um, some places, some societies will publish their abstracts in a journal, but that doesn't stand in the same place in your CV, and we'll notice when those are sort of there in inflating numbers in that way.
Great. These are all extremely helpful points. And so many of the things we've discussed kind of reflect what the candidates are putting forward themselves. But we also got a lot of questions about letters of recommendation, which have kind of come up at different points so far. So I'll open this to anyone to begin. What kind of letters do you recommend applicants submit? And specifically, we heard from attendees asking, do programs prefer kind of all pathology letters? 2 or 3 pathology letters and 1 from another clinical specialty. Kind of what are your institution and program philosophies on those letters?
I'm, I'm happy to chime in. So it is a red flag if you have 0 letters from pathologists. That is a problem. 2 would be good. 3 is not needed. I would far rather have 2 letters from pathologists or even 1 letter from a pathologist and a 3rd letter that really speaks to your skills in the clinical environment, your skills as a team player, your work ethic, from someone who knows you really well and knows what you want to do with your life. As I said earlier, it is poison for your application to have somebody write a letter saying what a great surgeon you're going to be or what a great dermatologist you're going to be. And I feel for those candidates because you're like, well, did they mix up their letters for their dual application or does this person just not know them? Letters, so at least 1 pathologist, and if it's not a pathologist, they have to know you really well and they have to know why you want to do pathology really well. One of the most important things the letter writer can do to strengthen your application is not something that you can really control at this point, but hopefully you've demonstrated it, is your emotional intelligence, and the kind of colleague you are. When I recruit residents, I'm not just recruiting residents, I'm recruiting co-residents for the community that I've already built, and I'm fiercely protective of that community. And the longer I do this job, the more I feel my obligation is to give them a good set of peers. And so the best thing I can do is recruit them good colleagues. And that shows up in letters from people who can speak to the kind of colleague that you are. I always say the best measure of a resident is what their co-residents say about them. So how are you to work with? So somebody who's seen you work in teams, somebody who can speak to how you work with staff, right? Somebody who treats the staff with respect, really important. We work really closely with a lot of professionals from a lot of backgrounds, and I love to see that you get along with all those folks and you treat them with just unwavering respect. That matters to me if it's coming from an internist, a pediatrician, anybody. So I would say, don't worry if you've only got one pathologist letter, but it's genuine and it speaks to your experience, and the others are coming from clinicians who can talk about those things, then you're in good shape. We don't have to have, as long as you've got one. If you don't have one from a pathologist, I'm worried that you wandered in here and you don't really know what you.
I agree with that. Minimally, Michigan would like to see one. Um, and I would also say that if you can somehow parse out that maybe this person in pathology or in a pathology adjacent field may be a small, I've seen some very short and terse letters from, say, a private laboratory CEO
Mhm.
or a coroner or something that really didn't spend a lot of time with you. It doesn't really help uh, support your total application. But if you've had a really great experience with, like one of my letters was from a psychiatrist that had a really amazing experience with a patient and made a really real difference in their clinical path. So something like that from a clinician is extremely powerful and way better than a CEO who really hardly knows you and can't speak much to what you've done for them and their patients. Um, I want to also add that if you're coming from another kind of residency program, another specialty, it's extremely important for us to see a letter of support from your current PD or the PD from the other specialty. We want to see that you've talked to them, that the rationale uh, makes sense to them as well, that they have that you have their support. Um, it uh, uh, it really is vital and could be a red flag if we don't get a letter from your former PD or your current PD from the track that you're changing from.
I'll jump.
All right.
Yeah, I was going to
Oh,
jump in
please go ahead.
for one more thing. So I think that at least last year and the years before that, there was an option for four different letters for a total of four to be submitted. Um, so again, I'm not sure how other people, other PDs on the call, but again, over the years, I've heard of program directors that said they would only read three letters. Now, again, you might, when you're going to your open houses and things, you might want to be asking programs if they'll accept four letters. But that's just something that I've heard over time. So be mindful that programs might only read three letters.
All right, thank you for those words. I'll direct this next question to Dr. Westbrook. We have a lot of international medical graduates who registered and are here today. And so many questions about the application differences for those applicants. And so how do you evaluate IMG applicants, particularly those, let's say, without US clinical experience or prior pathology training? How do they kind of demonstrate their own competitiveness for a US slot?
So that there's two questions there. So how do we evaluate them? I will say that we automatically, so I told you we have a scoring rubric that we parse out the applications between the committee and they score. We automatically review everyone who's graduated within the last 2 or 3 years, even from any international school. And then I usually it's me, just me. I personally then open all the other remaining applications and see, and I select more that I want to have fully reviewed, because I look for things like are they still in clinical practice in something? Like when was the last time they were practicing medicine in any field? And other things like that, because it's actually can be really challenging the way that they do the application to tell if someone's done a residency in another country or if someone has clinical experience in another country. So it can be really challenging. So I actually just open all of the rest of them and then send more for submission. We don't have an automatic cutoff for year of graduation. I know that's a big question. We do look at every single application. And you'll notice if you look at our current cohort of residents, we have plenty of international medical graduates. And then as far as distinguishing yourself, I think it's going to be hard if you have no pathology experience at all. I don't necessarily need to see pathology experience in the United States, but having zero pathology experience at all, it can be really challenging to prove that you love pathology now. So yeah, I don't know I don't have much advice aside from, trying to get some exposure in your home country if you can't get in the United States. And I think there's even some virtual pathology electives or observerships that I've seen people have on their application before. We don't personally offer a virtual observership. But yeah, I would say it's hard to have no pathology experience on your application at all. And distinguish yourself as someone who's very interested in pathology just through maybe your personal statement. I think that would be challenging. I don't know how others handle these.
We have a 10-year cutoff for medical school. If it's been more than 10 years, it's not likely you're going to get an interview with us. I will review some applications and make exceptions as needed, but it is a challenging situation.
Yeah, we generally have a 10-year cutoff as well, unless like Dr. Westbrook said, there's some continued clinical practice or some mixture of clinical practice and pathology focus or adjacent research that would be helpful as well. And historically, Michigan has not done a great job of, um, I guess, prioritizing international candidates for interviews, and we're trying to um, bump that up while balancing just the great historical sort of feeder programs that we have in our state and this area of the Midwest. It's very challenging. I mean, I think many of us get something probably on the order of 600, at least probably every year, we get something on the order of 600 applicants. And we have basically a hard stop every year now of 70 slots up for non-PSTP. PSTP for us is a separate interview process and separate track. Um, so it's still very tough, but we do prioritize those with pathology experience. Pathology residency is helpful. Pathology research is helpful. So those are some of the things that we would look for.
Dr. Mills or Dr. DeFrances, do you have anything to add to that?
I'm just having so much fun in the chat here. I'm just replying to all these chat messages. I think it's honestly just really fun to hear all the PDs talk, because I do feel like we have such a shared ethos about this. Like we are in the coolest field. You guys are dipping your toe in this really cool field, and we have this wonderful privilege of trying to bring up the next round of folks. And at the end of the day, it's daunting because there are so many brilliant people who want to do this job, and it's kind of this like burden to have to choose who gets to do it at our institutions. But also such a privilege to do it. And unfortunately, there's going to be so many people who are qualified, that there's this art to it. And I always joke, like one year recently, my residents were like, "How'd you do it?" And I was like, "Do what?" And they're like, "How did you find all my best friends and put them in a class with me?" And I was like, "Oh yeah, it just happens sometimes." And Ideally, this whole thing happens organically. I understand though, and I feel for you guys because it feels so stressful and inorganic right now. But I think that's just where the authenticity piece comes in. And, if you love research, put that in the forefront, go to apply to the programs where that is really the engine. If you don't, just be honest with yourself and your programs about that. If you're like, I'm a forensics person, I want to go somewhere that is trained the very, fed into the very best forensics fellowships, be frank about that and seek that out. And yeah, maybe you'll find a program who's like, oh, we don't like those forensics people. Great. They won't interview you and you won't be stuck somewhere you don't want to land. So I would just say like, just try to be true to yourself and hopefully it'll all sift out for the best for everybody.
I'd like to add to that. I would just say that I'm here because, and I think the other PDs too, because we really love pathology and it's just a great field. And although this is a very daunting and drawn out process, and personally I hate the match, I think it's very dehumanizing. It is what we have, and we want you all to succeed. It's a great field. And while sometimes I feel like, oh, my heart is going to break if this person doesn't match here, I remember that they're going to match somewhere. They're going to find a place for themselves. And it's a training program. They may stay there the rest of their career, or they may go somewhere else and be very successful. That being said, pathology has suddenly become very competitive. And there, I think there were a large number of people who didn't match last year, and all the spots were filled. There was nothing available in the SOAP. So keep that in mind, but it is a great field. And I think the fact that you're here at this meeting gives you a head start because you have an idea of what we're looking for from a broad range of programs. And it's a great time to be a pathologist. It's so exciting with all the discoveries, the molecular applications that directly drive treatment. Industry is clamoring for pathologists, academics is clamoring for pathologists, private practice wants pathologists. There's so many opportunities everywhere. And, we are the ones with the truth in medicine. Pathology is the truth. We tell everyone what they're doing right and wrong. We have the answers. And it's so exciting to have that. So get excited about it and go for it.
What a wonderful, wonderful response. Dr. DeFrances, I know you're going to jump in. Do you want the last word, a last takeaway pearl of wisdom?
Yeah, I mean, that was a pretty good one. I'm just like, when you're thinking about, programs and you're thinking about that rank order list and things, and really, just follow your heart. Think about, where you feel like you're going to fit in the best. And again, we talk about how this whole match process is a bit dehumanizing, and there is this algorithm that is run. But do know that is, I understand, it's an applicant proposing algorithm. It's the applicants kind of have more power in that process. So just follow your heart in terms of making your rank order list and try to enjoy this process. I know it can be daunting, but try to enjoy this process. And I wish you all the very best of luck and take good care.
Thank you all so much. Just at this point, out of respect for everyone's time and on behalf of Virtual PathSig, I want to thank you all for attending today. A massive thank you to our program directors who provided such valuable insight and information and took the time out of their day to do this. Before we wrap up, if your school has a pathology interest group, we would love for you to scan the QR code that's going to be put on the screen so that it can be added to our interest group registry. This is an initiative we've been working on in collaboration with the National Association of Medical Examiners Future Forensic Pathologist Committee. That's a mouthful, to help connect students interested in pathology across the country. As a reminder, if any of this information was extremely valuable and you want to rewatch it, or if you joined late, this session was recorded and will be available on our website, virtualpathsig.org, within the next few days. And that link should be within the chat from earlier during the meeting. And lastly, we want everyone to check out the events and webinars section on that site for upcoming events. Our next event is going to be in September, where we're doing a transfusion medicine and blood banking subspecialty highlight. So please sign up for that. We're also keeping an updated list of residency program open houses, complete with event dates, registration links, and program context. So if you don't already, please follow us on Instagram or X and Twitter at path_SIG. And with that, that completes our session. So thank you all for joining. Thank you to our panelists and have a great evening.
Bye,
Thanks,
everyone. Thank you
everybody.
so much.
Nice job, Ryan.
Thank you.
Yes, thank you, organizers. You
Everyone,
guys rock.
thanks for joining.
All right, take care all.
Bye-bye.
Bye.